today. As you know, we were doing weekly COVID calls that were really pretty well attended. We appreciated all the attendance back during 2020. For 2021, we don't think that your schedules nor our energy would necessarily keep up for weekly calls. So what we're going to do is we're going to go to bi-weekly calls, and they're going to be across a variety of topics, not just COVID. So the topics that we know we're going to be covering, we're going to be trying to cover the waterfront a little bit. We know COVID's not over. There's still COVID to deal with. And so we'll continue to have some topics that are around COVID, but we're also, with the new administration and with ECFC's typical policy focus, we're going to be doing more public policy oriented, and we're going to look at inside strategies and outside strategies. So we're going to have some programs that talk about how you can partner, because ECFC members are fantastic at partnering with their public agency partners. Like, we have tons of state examples of that and local examples, and hopefully we will have even more federal examples starting soon. And then also, as you know, we have the Raising Childcare Fund, we have advocacy investments, and so we're going to have some programs related to community organizing, advocacy, and those like outside public policy strategies. So that's what to expect. I think this is the first official one for this year. It'll be a mix of COVID and then a mix of public policy topics that emphasize both inside and outside strategies across the year until we can be together again. So today's topic was a high priority and timely, and requested by our steering committee to talk about how we prioritize early childhood educators to get COVID vaccine, and what philanthropists at state, local, and national levels could be doing to support. And so when I brought this up, I heard from our partners at the Alliance for Early Success that there was a work group working on this among the national advocates, so that was very timely. And they pointed me to NAEYC Lauren Hogan to talk to us about it. And so today we have representatives from NAEYC, from Child Care Aware of America, and from the National Association for Family Child Care to talk to us a little bit about what they're thinking, what they're doing, and then hopefully they have some ideas for us about how we could be facilitating, and we'll have some open discussion too. So I think I'm going to turn it over to Lauren to moderate. Thank you, Lauren, for being with us. Lauren Hogan from NAEYC.
Great, my pleasure. Thanks, Shannon, and hi, everybody. And I will say my colleague, Lucy Rescio, has been doing just an enormous amount of work on this on our front. She was going to be here today to join, but she is out sick today. So I'm going to do my best to fill in on her account. It was great to hear Shannon sort of talk about the mix of COVID and policy, because COVID vaccines for the early childhood field are basically the mix of COVID and policy all at once. So we'll be able to address a whole bunch of issues facing that today. I'm going to talk just a little bit to start about sort of how Shannon sort of mentioned a work group essentially. And it really is a number of us who wanted to come together to ensure that the early childhood field at large was getting consistent, clear messaging from national organizations, regardless of sort of where their membership lies, what constituency they are, what setting they sit in, what state they sit in. We really wanted to overcome some of the fracturedness within the early childhood education workforce and really make sure that everybody was getting the same information about the vaccine as we were learning it, how to sort of, address some of the challenges in misinformation, the trust challenges, overcoming the history of racism that really embeds with a lot of our historical experiments and medical experience, to make sure that we're really addressing our workforce, which is primarily women of color, making sure that we're really acknowledging the realities about how people are feeling about the vaccine and how we make sure that they have access to it. So we really have come over the last, I would say, our conversation sort of started in earnest probably in December, and we really brought together just a number of different folks in the field to talk about what they were hearing from their fields, what questions they were having, sort of, and then how we wanted to approach our messaging. And we'll talk a little bit more at the end about some of the strategies that we've developed as a group so far, to be able to do outreach to our constituencies and communities. Some of the questions that we have been hearing, and we'd love to hear that from you all as well, about sort of where you all are hearing challenges and how you all are thinking about resolving some of those. The three organizations here are just a subset of all of the organizations. There are a number of folks, family, childcare, Head Start, the unions, who have been part of these conversations to be able to move this forward. So it really is, we're very much in the more the merrier situation on this. We want folks to be coming together. We do have a webinar planning underway in which we're trying to ensure that as many folks as possible can join us in co-hosting and sharing it out with their fields, and in making sure that we're really responding to the needs of the field as we talk not only about the elements of prioritization. So there's the piece around, are we ensuring that early childhood educators are prioritized alongside of their peers in K-12 and healthcare and sort of essential frontline workers within their states? For us, the messaging on that is both about trust building with the field to ensure that they see the national organizations working to ensure that their fields are spoken for, that we're fighting for them to ensure that they have that voluntary access, and also then in tracking on the state sides to make sure that we're really responding to that. So we'll get into all of that in a minute, and I'll start by turning it over to Nikki at Child Care Aware to talk a little bit about what they're seeing in the prioritizations around states in their tracker.
I'm going to actually pitch it to Mario, who's going to take that.
Go for it. I'm always good as Lucy sometimes.
Well, I'll just say thanks, Lauren, for that lead up. Thanks, Shannon, so much for bringing us together to talk about this. So I'm the Mario Cardona. I'm the Chief of Policy and Practice here at Child Care Aware of America, and I'm joined by Nikki Garrow, who's my colleague, who's been focusing on that issue. And to Lauren's point, it's been a critical part of our work over the last several weeks to track how states have been treating their vaccine distribution and how they're prioritizing particular populations within occupations. And so I can describe a little bit about some of our work, what we've seen, and then would really love to have a conversation with you all afterwards and engage in any questions you all might have. And so what we've been doing here at Child Care Aware of America is really just reviewing each state's vaccination plan to understand how they're prioritizing child care providers, and monitoring also state plans to ensure that they're treating child care providers equitably in terms of prioritization relative to K-12 educators. And so in looking at that, we've seen 44 states in DC have currently specified or specifically mentioned child care providers can get the vaccine within the second phase of prioritization. So that's after essential workers are treated in those long-term care facilities. And child care providers are generally prioritized with parity with K-12 educators. We have seen in 4 states, Florida, Indiana, Texas, and West Virginia, where they've only developed criteria for their first vaccine phase, which has included first responders, essential healthcare professionals, in those long-term healthcare facilities, and folks over 65. But to date, none of the states have developed criteria for additional phases and have not noted when child care providers will be able to get vaccinated. And then in 2 states, Vermont and Rhode Island, initially they'd included child care and K-12 educators in the same phase in their state plans, but have now shifted to using age groupings over occupations to determine who can receive the vaccine. And one emerging issue that we've seen is that there is a prioritization of decisions being made within the second phase, and that some state second phases are beginning to prioritize K-12 educators first and then making vaccinations available for childcare providers later. And we've identified 5 states where that decision was made: Kentucky, Oklahoma, Ohio, Utah, and Wyoming, in addition to the District of Columbia, which has some real consequences for folks on the ground. And looking at DC in particular, we saw that they began vaccinating K-12 educators the week of January 25th, while child care providers were not eligible to be vaccinated until this week, despite being in the same phase. And so, it's been important for us to be monitoring these developments and give really clear, accurate information to the communities that we serve, to Lauren's point, just so that everyone has access to up-to-date information, because it's critically important for the providers, obviously, who could benefit from receiving the vaccine, but also the families that they're serving and then children that they're serving. And also, too, we think it's critically important that there's parity between K-12 educators and childcare workers, because a large part of the discussion around the K-12 educators and their prioritization is that it's a key part of a reopening strategy for K-12 education in this country. And we've seen the greater majority of K-12 schools remain closed during the pandemic. And we know that childcare workers are still working. They're serving families now. And they're an essential part of making sure that frontline healthcare workers are able to meet their obligations in addition to everybody else who needs to rely on childcare in order to meet workforce obligations. And so it's a critical need. And it's something that we want to make sure that all the communities that we impact and serve have accurate, up-to-date information about how states are making prioritization decisions. And again, this is dynamic too, because states are making shifts in their planning based on the dosages that they receive and what they have available to them and their ability to administer the vaccines in real time. And so we've been updating the tracker that Lauren mentioned pretty frequently, so that folks have a sense and a clear picture into the changes that are happening on the ground. And so we think it's critically important work, and we're glad that you all have an interest in it. And we've been really fortunate to work with the other organizations on the phone in this work. And before I pitch it over to Lynette, I want to make sure that I captured everything. Nikki, is there anything else that I should have mentioned or maybe failed to reference?
No, I think you've got it covered. I think just in conjunction with what Lauren had mentioned previously too, we're in the process of developing kind of a vaccine 101 fact sheet. We did some kind of informal polling of our membership, which are CCRNRs and some community-based organizations. And there was a lot of just like general need for basic knowledge about the vaccine amongst the childcare community. So we're putting that together. Obviously, there's a lot of information out there that's flowing all over the place, but we're kind of like a different source. We might have the ability to get to the people who may not get that information, on the CDC's website or something like that. So I just wanted to point that out as well.
That's a great point. Thanks, Nikki. And we'll look forward to your questions later on. But at this point, I'd like to turn it over to Lynette Dumas, who's the Executive Director at the National Association for Family Child Care.
Thank you, Mario. And I'm so happy to be in this space with all of you. Before I get into my part, I do want to make sure to draw to everyone's attention that Lauren did drop the Child Care Aware tracker in the chat. So you can link to that. So that's my Child Care Aware plug. As Mario said, I'm Lynette Dumas. I'm the Executive Director at NAFCC, and we're just excited to echo what's been said already by Lauren and Mario, because this is a comprehensive field, and home-based childcare has a place in it, and it's not also too, but just a part of the fabric. And so while we're happy that many of the states have included childcare workers in their vaccination prioritization, we want to make sure that in those state definitions of childcare workers that home-based childcare is included in the definition, and that there aren't any undue barriers that would limit access to the vaccine for these frontline workers. Throughout the coronavirus, I guess since April, we have been surveying our membership, and our surveys have shown us that family childcare programs have stayed open. Almost 70% of them have remained open at some capacity throughout, not closed, serving essential workers, frontline workers, and this means that they are also putting their families at some sort of risk, because they're bringing this into their homes, not just like a healthcare worker where they're at the hospital or the long-term facility. This is actually coming into their homes. Excuse me. And as Lauren pointed out, almost 100% of these folks are women. There's a large majority that are people of color and or immigrants who are English isn't their first language, which causes a number of barriers, as mentioned by Lauren earlier. So we want to be certain that states are explicitly naming child family childcare and home-based childcare. So that's licensed and license exempt care, and then potentially looking at family, friend, and neighbor care, which is a little less regulated in states. It varies by states. So we want to make sure that those folks who have remained open and supported the workforce, they're the workforce behind the workforce, that they are being that they have equal access like the rest of the field. The other thing that we noticed throughout this crisis is that where there are strong connections and trusted voices, family childcare does better. And so we know, like when the PPP became available and the EIDL became available, it was harder, people were slower to have an uptake of those CARES relief products because they were not sure that they were eligible. Sometimes the verification documentation wasn't appropriate for their setting. So we want to make sure that while we are when I'm going to be hopeful when family child care and home-based care is included in state prioritization plans, that the documentation that is required of them is not inappropriate for their setting. It's something that they can have easily access and easily present in order to show their eligibility for those vaccines. And the other thing is that, well, another thing is that we want to make sure, as Nikki was saying, that the communication is very, very clear that it does include home-based care. So when you're saying child care, they have to know that this means them. Lots of folks, when states were issuing guidance for closures, folks in home-based setting were often left in limbo because there was no specific guidance that said this applies to home-based as well. And so we want to make sure that it's clear to them that they not only that they're eligible, but what the alternative verification methods are for their programs and businesses. And then we're kind of concerned about some unintentional consequences, just being forward thinking and thinking that once we have folks vaccinated, voluntarily vaccinated, that there's a potential for loss of income if they have to close their programs for the day to get to the doctor or the facility to have their vaccine. Then we know that there have been some challenges around the second doses where folks are being sick after the second doses. For a family child care provider, there's not another person there to provide the service for the children. And so they would have to close, which would mean a loss of income and also potentially loss of work for the families that they serve. And the other point, and also I wanted to add that with food program, if I do get someone else to substitute for me, then I cannot charge the food program for the meals that are served that day because it has to be served by the family child care provider. So if I have a substitute there, then that day is disallowed for reimbursement. So we want to make sure that we're thinking about these things in a forward way because the margins are razor thin for these folks and we don't want to cause undue hardship while we're trying to relieve this other problem. And noting that reimbursements can also be a challenge because you've got to have the upfront money in order to be reimbursed. So those are my thoughts on the unintended consequences and the straightforward ways that we need to think about how we are inclusive of the entire field of early care and education or child care workers. And so I think I'm going to pass to Lauren. Am I right?
Thanks, Lana. And we can, if folks have questions, feel free to throw it in the chat or come off mute or whatever. We're happy to sort of chat as you guys have questions while we're sort of talking about, you know, some of the pieces that we've seen already. Lana identified some really important sort of buckets of need that we have seen emerge as folks have been addressing some of the challenges, both in terms of their prioritization and then the like fundamental logistics of how they get equitable access to the vaccines, which is a real, again, we've started to hear about and know of a very few number of early childhood educators who have started to get access to the vaccine. And Mario mentioned DC, which in the last I mean, it was like 2 weeks of sort of frenzy, went through having educators sort of at the top of the list. They got bumped down. The advocacy community really snapped into gear and we're getting petitions and putting some substantial pressure on OSSI, which is the state education agency, and on the mayor to sort of move in terms of their response to ensuring that early childhood educators were having the equivalent access. And they respond, I mean, the advocacy worked there. It's still a little unclear about where they are and how they're getting access and how then fundamentally can they sign up. But there was clear pressure. There was media pressure. There was media responses. There were stories in the Washington Post. We saw something similar in Ohio where there was some substantial outrage around, well, we heard they were going to be together, but then they weren't. And having sort of educators at the K-12 levels speak out for their early childhood education colleagues to be able to say, hey, I saw, the Washington Teachers Union said, like, we think we want our early childhood educators to get the vaccine as well. That kind of stuff makes a difference in terms of the support, and the funding community, having invested in the advocates in DC and in Ohio over the past several years, made a tremendous difference in terms of having the advocacy infrastructure they needed at the moment that they needed it. So they had these relationships developed because the funders had put the money where it needed to go to have those relationships to be able to sort of activate them in response to this real challenge where educators, again, who have been just on the front lines, have already felt so deeply devalued, in part because they are deeply devalued, then are seeing this moment where, again, when it comes to the vaccines, where it's being used to help K-12 open again, and this idea that, well, early childcare is already open, so it's not helpful to use it as a way to open, which there's a whole, speaking of policy, there's a whole sort of political and policy play out for that. So a couple of areas of need that we've seen around so far, there's a real need for the communications, like Nikki talked about. A lot of information out there, not all of it good, a lot of it confusing, much of it not relevant or accessible to early childhood educators, and certainly not translated in enough languages to make it really meaningful to folks, or in formats and medium and media that make it available. So it's not just about having a written PDF that folks can download, but what are the other channels that we can use to really make sure that folks are getting the information that they need. The logistics are a substantial challenge for our folks, both in family childcare settings and center-based. I've compared this process to the census outreach that a lot of us did a little bit. It's a little bit of a not one-to-one comparison, but this idea that we have to overcome some fear, and especially some communities, about the vaccine is similar in some ways to how we had to overcome fear about the census, especially when there was a lot of citizenship questions that were going on in the census. How do we reach out to folks? How do we use our trusted relationship status to be able to say, this is okay, this is safe, let us share this information with you, let us talk about what it means. So, like, a concept of a sort of vaccine navigator that could sit at somewhere like an R&R or a family childcare setting or an affiliate that would really help folks sign up, get what they need. We have broadband access. All of this is online access. People are just like, I can't get in. I can't get in. I don't know where to put my thing. I don't know how to do this. All of those challenges. And then some of the challenges Lana talked about in terms of substitutes and not having them, emergency medical expenses. The vaccine is supposed to be free, but we know folks are going to get charged for office visits and that kind of stuff that they shouldn't be. But that can put it into a category of a barrier that is really difficult to overcome. Lost wages and transportation costs. And then just the advocacy activation challenges, sort of support to coordinate the efforts to ensure that the messages are reaching providers, to think about the roles of all of our organizations and networks and being able to really move this ahead as they're dealing with the challenges in their state and local areas as well. So those are a few of the buckets that we've seen. Nikki and Mario, I don't know if you have anything to add on R&R sort of role in some of this, and Shannon, if you have questions as well.
Yeah, thanks for that, Lauren. You know, I think just to echo some of the really helpful things that I think Nikki, Lynette, and Lauren all mentioned is the need for communication, and also for that communication to come from trusted community members. And so, you know, I think based on where we sit as a national organization, having a connection to our network of child care resource and referral agencies, you know, we're really fortunate to have these direct lines of collaboration across a full array of child care stakeholders. So it's families, providers, state system leaders, in addition to state advocacy organizations, unions, and coalitions. And so, you know, in addition to making sure that folks have access to the tracker that we've been developing, we've also been, you know, tracking some of the developments with respect to prioritization in some of the states, and also arming with the CCR&Rs with examples of advocacy efforts in those states to really give voice to the need to make sure that there is parity between K-12 educators and childcare providers. And so that's something that we've sent out to our folks to make sure that the folks on the ground have all the information and tools that they need to inform their advocacy on the ground. And so, yeah, just to echo the point about making sure that a lot of this information is coming from trusted community members, if for no other reason than also the information isn't available anywhere else. This is the kind of thing that you would think that the federal government would monitor or somebody else would monitor. And at the moment, it's something that's being undertaken by national nonprofit organizations who care about this issue. And it is a labor-intensive ordeal because there is no automated way for us to be tracking this in the States. It literally takes a staff person to go into each state plan on a daily basis to see what's going on and to monitor the news and everything like that. And so to also echo some of Lauren's point, I mean, the logistics around this have not been unburdensome for us and our organizations, but we're happy that we're able to provide this resource to our communities. And with that, I'll push it back to Lauren, unless we want to open it up for questions.
So I have a question, actually. Did you have another point you wanted to make before I ask a question? Okay. So just to recap a little bit what I heard you said, and then I hope other folks will have questions. So I was thinking about, Lana mentioned the PPP example, which to me was a very salient example analogy, because that was, you know, sort of something that people were dealing with last year. And a couple of things you all mentioned that seem relevant to me is people in ECFC, and I'm looking, I know the folks on the phone, you guys don't, most are place-based funders, not entirely, but the vast majority. So most of these folks already have relationships with the R&R or their local AEYC or their local Family Child Care Association, just because we have you, but there are probably other people too. I'm just, because you guys are on my mind because you're here, but they have connections with the folks, right? And so the thing that I think made the PPP efforts work where they worked was nobody was starting from scratch building a new relationship on a project with a tight deadline. And so it seems like approaching the people that you already know and you already have relationships with and grants with and saying like, hey, what about a vaccine navigator? Or, hey, Lauren, to your point, you know, when we spoke before, we're going to need Somali and Hmong folks in Minnesota, you know, like approaching folks that you already have relationships with and talking about vaccine navigators, talking about translation of materials, talking about substitute expenses are things people could be doing, it sounds like. Is it one question I had thinking through this though, is anybody thinking of paying people to get vaccinated? Like there's been this thing about grocery workers, and I saw that OCC said that they've released the 10 billion for their CCDF. And so one thought I had was like, well, they've got 10 billion to spend. This would be, it seems like a drop in the bucket to give everybody for a state to give everybody a bonus to go get vaccinated, which might cover some of the cost Lana brought up. Is that being discussed?
We have just, that's what came up yesterday. We were just talking about this actually.
Okay.
Like, just the, like, is that an option? How would people feel about that? Like I've heard of private companies who I know are trying to do it and thinking about sort of as an incentive. You know, I think there are challenges to thinking about what that means in terms of who gets access, what it means in terms of it's like, I think there's some moral questions about it that like raised when we were having that conversation. And and the sort of racial implications of it. I think we had talked early on about just the question of what will it mean when folks start to say, you know, we have a 100% vaccinated early childhood center, and what does that mean for who has access to it? And at this point for us, we sort of felt, I think as a group, and again, you know, these really have been sort of meaningful conversations that we've been having, but that until it is more widely available, it is very hard to sort of have those conversations, because it's really hard to make something mandatory or incentivized that people can't get access to. So as long as we have some of these substantial access challenges, we wanted to focus on ensuring that equitable access piece. So are we addressing, can they get there? Can they sign up for it? Can everybody in all of their different settings do that? And so really thinking about addressing those costs and those barriers was where we wanted to start in terms of thinking about, but I think getting people money is good, generally speaking. So like how we can think about combining those two efforts where we know their costs are going to be. Hey, Nancy.
So we have a question in the chat. Sorry if you saw me talking. I was calling out. My neighbors have COVID, and I was telling a teenager, don't take the car. I've got to go pick up their groceries. What do we got? All right. So let's see. Mara, do you want to answer your question out loud?
Sure, I'm happy to, and I really appreciate the conversation. So I'm coming from Chicago, so childcare workers are included in 1B, so it is available to them. And kind of we've been doing some surveying, to your point, through our CCR&R and other resources, and noting that uptake is also a challenge. So we have had it available to childcare providers, and they have expressed, kind of as noted by some of the speakers, some hesitancy. So I'm curious if there will be any best practices for reaching EC providers and any communication materials kind of targeting this population.
Nikki, do you want to start? Go ahead.
Well, I was going to say, I think there are some resources put out by the CDC and others that some of it is applicable and some of it is not. So, you know, I believe it was at the beginning of last week, the CDC finally released their full toolkit of all the stuff focused on community-based organizations and working with local communities. And I think some of that can be adapted pretty well. And we've had success with adapting some of the other COVID-related materials that at first, when a lot of things were focused on K through 12 and not childcare, we were able to kind of adapt some of those things. But I think it's kind of like, it's still like a work in progress, and we're going to have to be evaluating what we're doing to see what's working and what's not, because we're kind of in an unprecedented space. I mean, there's some public health messaging that we do, at least at our organization, about giving your flu shot and stuff, but we haven't really evaluated how that's impacted the community. It's kind of highlighted we should be doing that to see like what the best practices are. But I think a strategy is also like as many modes of communication as possible. So that's my thoughts on that.
I just add one of the things that and again, I don't know that we have best practices yet, though we certainly aren't the only ones thinking about what those are. A couple of things we thought about were making sure that people had just like very fundamental facts about the vaccine. That was one of the places we started, was like, we were hearing even from Nikki, like, and talking to Head Start, like a lot of like, are we going to be injected with COVID? I don't want it because it's going to, like really sort of baseline health questions about what is happening when you get a vaccine. That again, like NAIC is not the one to answer that on our own, but to facilitate the relationship from a actual physician through the trusted messenger to the field, that's sort of what we are trying to work with. And to say also, now that we have some childcare providers, and folks have been trying this in other fields too, obviously particularly in medical, but let's talk to other childcare providers who've gotten the vaccine. What was it like for them? Like to feature each other as they get the vaccine, to be able to say, look, here's another childcare provider who got it. And as we're putting together our webinar collectively, really thinking about that as well. Like we need some childcare providers, especially from communities of color, who are going to be able to talk about they got the vaccine. Let me tell you about that. We think that's gonna help build that trust.
Nancy, I see you. Go ahead.
Yeah, I'm sorry I was late. I had another meeting. But two things that we've done is had childcare staff take pictures of themselves with a little like poster that says, I got the vaccine because, and then they each put, the reasons that they did. And then we put it out on social media. And that seems to be helping. And then the other thing, I got a list of providers from the Governor's Children's Cabinet, the providers in my region that were, I don't know, selected, I guess, to get a vaccine. And I emailed all of them and just encouraged them to get their vaccine. And I got actually quite a few responses from those emails. So that's something that we've been trying to do, is just encourage and use a little peer pressure. And sorry, my voice is not good.
Thank you for that example. You always are like calling and emailing everybody. You must be up 24 hours a day. You're calling and emailing everybody. So it's so impressive. Do other folks have examples? I think that's a really great example, especially the use of social media. Anybody else have examples they want to share?
I'm always following Nancy's lead, but I've got a fairly large Somali and Latinx population, basically meat processing workers. And of course, meat processing is one of the highest risk professions there is for COVID exposure. So we're appealing to the entire family that dad may be bringing it home, or if the kids get it and spread it in the child care, because a lot of it's home-based care. So we've got Latin staff, we've got Spanish-speaking staff, we have Somali staff, and they're just trying to appeal to family health. And obviously engaging religious leaders matters a lot in both of those communities too.
Thanks, Don. Other thoughts? Lena, do you have advice for folks on family childcare? Some of the folks that we're just speaking already have strong connections with family childcare in their communities, but are there additional things? Because we don't, home-based childcare is something that a lot of our funders are very interested in, but not everybody might already have direct connections to home-based childcare in their communities.
Yeah, the truth is that home-based childcare is really the same as childcare centers. It just happens in the home. So it to the point that Don made, that the families are more at risk. You've got actually more people that probably should be eligible for the vaccine. I guess they should count as staff to be childcare workers. So I'm not 100% sure are you saying how to reach them, or is there a different strategy? I think everything that people have said so far is it's about the connections, it's about the trusted. And so those happen with the CCR&R, those happen with the provider associations, the networks. It happens with the food program sponsors that I was talking about earlier. They're trusted connections that happen in different places, and they're all the places that you guys are talking about. But I'm happy to, if I'm not answering that correctly,
I think that's right. You're just talking about, and actually the food program sponsors credited, like different intermediaries is the way it sounds like most people will be able to engage.
Yeah.
And Laura asked a question about partnering with health orgs, and that actually hasn't come up. I was wondering if you have samples, or is AAP sitting? That was my first thought when you guys were talking about we're not the one to get the message. I thought, oh, the AAP might be at your work group table.
They're it.
Okay. So say a little more about, like, for folks who are on the phone who might be working in a state or local context, like, have you guys seen partnerships working yet?
Yeah, I don't know if folks on the phone wanted to jump in, but we have seen, I mean, I've seen a few that have been, I mean, reaching out to their local hospitals as they're getting vaccinated, to Black doctors in particular and Black healthcare providers who have been able to sort of speak specifically to the need to talk about what this means in Black communities, and really sort of honing in on those messages as well. And we have been connected. I mean, we've been working with the AAP, who will be sort of, you know, they're working with a healthcare provider and they'll help us sort of get that information out. And also, as the CDC sort of builds back some of its capacity as well and some of its resources and materials, to be able to rely also to Maria's point about where the work lies, to be able to rely on the CDC for their sort of messaging and their expertise as well. But I think supporting childcare communities, whether it's through sort of any of the existing relationships that you have with any of the local folks, to support them in having the time and having the explicit intentional connection with the healthcare provider who really can do that, is really important. Whether, like, again, webinars have been super helpful. They're great ways to share that information, but it's not the only way that people are able to access that. And to really have, to Lana's point about the PPP, the states that did the best on that were like the one-on-one, like, here, we're going to get you through this rather difficult, kind of complex process, and we're going to take the responsibility for doing that kind of one at a time. And that is one way to think about incentivizing it. It's not to incentivize the providers to get it, but to incentivize the people who are helping the providers to make sure that they get the providers through.
Yeah, and when I think you guys were describing the online process, I'm just thinking what we learned about elders, right, who were in the first tier, like the number of hours people are spending. So I think it, you know, it hasn't trickled down to any group I'm in yet, but I was just thinking, a family childcare provider, how is she going to do that? You can't, you know, she can't be sitting there for 5 hours hitting refresh, trying the 4 different providers in her community to try to figure out who's going to have an appointment. And that just seems crazy. That navigator for a family child, for everybody, but especially a family childcare provider, how's she going to do that? Dawn?
She's calling her daughter, who has dropped out of the workforce, because she can't do all of it all at once.
One of the challenges, of course, is this is not a coordinated effort. Every state has their own policy. I serve a pretty rural area. I got a frantic message from the Secretary of the Children's Cabinet today saying they had a clinic open in one of my smaller economic hubs and no one was showing up. And so I blasted out to providers today saying it's available miles from your house for the next 3 days. But if we don't get turnout, I'm not sure the state will try it again. And the alternative was to drive an hour each direction, which is far more difficult. So this was just walk in and they'll shoot you on the spot.
But if you're a family childcare provider and you haven't planned for a substitute, and then how are you going to drop everything and go, right? Or yeah. So.
And to be honest, I don't have the details. I presume they have to be giving extended hours if that's the target audience. Right. And it's not only for providers today. There is also educators. Right. But I'll just be crushed if my providers can't take advantage of it.
Right.
One thing I want to mention, and I'm sorry.
Go ahead.
And I don't know if you mentioned this earlier, Lauren, and I apologize if you did, but you know, you and CLASP and Ed Council developed that really helpful recommendations around the $10 billion that states could use from the last round of relief from December that states are going to have to submit plans for in the next, I think, 21 days. You know, and one of the ideas that you had in there was to have paid leave time for childcare providers so that they could get voluntarily vaccinated, in addition to some other really, really helpful recommendations or strategies that states can consider with respect to using that fund. Or that funding. So I'll just share that with folks in the event that it's helpful, because I feel like it's a really helpful resource.
Thanks. Yeah, put it in the chat. That's good. I think for folks who are members of ECFC, I sent it around on our listserv, but I don't think everyone got it. So Okay, so as we get toward the end time, I guess I want to turn it back to our speakers to see if you have any last words of advice. It sounds like the other thing is this is going to be an ongoing. So let's let you think about your last words of advice for us. I'll make an offer that we send out newsletters every 2 weeks. So if you have, you know, additional examples, or you put out something that says, here's 5 things we need to see happen, and you want funders to know about those 5 things, we can definitely blast those out. And Rena Large, who never comes on camera very much, keeps our website incredibly up to date. So she can, you know, put those things out on our website too. And so feel free to share your last words, and then I will plug what we're doing 2 weeks from now.
I'll say it. Let's make sure that home-based childcare is explicitly named and that there's clear communication and that we're mindful of unintended consequences for those frontline workers being a part of the vaccination effort.
I mean, for us, we'll continue the work that we've been doing with respect to making sure that communities have the information that they need with respect to vaccine distribution, and making sure that also folks are aware when there is a lack of equity in access to the vaccine between K-12 educators and child care providers. And if there's anything else that you think we could do differently or better, or you know, a way that we can utilize some of our networks, you know, we'd welcome your feedback.
And I would just add to Don's point, this is really different in every community and that is one of the things that makes it hard. So the ability to learn from each other and to share what's happening, to say this is what we learned here and what we learned there. This is also being layered on top of like everybody is already doing so much. And this is on top of that, right? Like now everybody has to figure out how to make sure that people have vaccines, and to make sure that folks have the support and time to be able to do that intentionally, so that we're not having a community that already feels so left behind and so undervalued, even more so in the end. Like this is an opportunity to ensure that they both feel valued and are actually safe for the work that they've been doing. And so it's just we're delighted that you guys are having this conversation and brought us in, and we're looking forward to continuing to do the work together to make sure that the community feels supported by all the national organizations and folks who are involved. So thank you.
Thanks. So in 2 weeks, I tried to put it in the chat, but I kind of botched it, so I did it twice. We're going to discuss this. There was a framework that Shelley Waters Boots, who some of you know, and Tom Friedman Consulting put out about how philanthropy can partner with the next administration. Oh, see, I should have waited for Rena. And so everybody can read. There was a webinar on the topic, so you can go watch the webinar. It was actually, I learned a lot from the webinar that they did. And there's a quick 2-pager that outlines 4 different ways that philanthropy can partner with administrations. So next week, what we're hoping is people will do a little homework and either 2 weeks, sorry, either read the document or watch the webinar or both. And then we'll just have a peer discussion about these different ways you can partner with government and what you want to see ECFC do, particularly at the national level. But I will say that the 4 areas that they bring up in the paper work at all levels. They're not specific to the national level. So with that, I just want to thank Lanet, Nikki, and Mario and Lauren for being with us. It was great to have you, and we look forward. What I heard was this is an ongoing discussion. It's not quick, and we've got to focus on access, and then following up with that, like actual facilitation of people getting the vaccine. And as always, we've got to focus on equity. Those are my takeaways. So I really appreciate it very much. Everybody have a good afternoon.
Thanks, everyone.
Thank you.